Good morning, ladies and gentlemen. It's my great honor to have my talk in this Insight Session 2018, sponsored by Canon Medical Systems in ISUOG 2018 in Singapore. My talk today is the latest advances in placental evaluation using high-resolution ultrasound and the spar microvascular imaging, SMI. My disclosure of COI is shown in this slide. This slide shows table of contents of my talk. The first topic is SMI, the second is normal placenta, the third is placenta in FGL pregnancies, and the last topic is the use of an 80 MHz probe for the diagnosis of placenta ACCRETA. SMI is a new technology innovating conventional Doppler imaging. Main characteristics of SMI are suppression of motion artifacts in the low velocity flow range, high sensitivity, high resolution, and high frame rate. SMI is a new imaging mode which uses a proprietary algorithm to isolate and eliminate clutter without compromising loss of clinical information, which while scanning at low velocity states. Traditional motion artifact filtration removes clutter and some clinical signals. SMI has higher frame rate in comparison with the conventional Doppler technologies. So there is an information on both vascularity and motion artifacts in the low velocity flow range. Conventional filter technology eliminates both low vascularity information and motion artifacts. However, SMI's filter is capable of suppressing motion artifacts and keeping low vascularity information. So SMI can detect very low flow velocity and peripheral small vessels. The second topic is placental vasculature in normal pregnancies. Can you see? This is SMI images of the normal placenta at 11 weeks and 3 days of gestation. SMI clearly shows intraplacental vessels, such as primary and secondary stem villus vessels and spiral artery jet flow. This slide shows the comparison of placental blood flow between conventional color Doppler and SMI. As you can see, SMI clearly shows intraplacental blood vessels compared with conventional color Doppler. This slide presents 3D SMI image of the normal placenta at 11 weeks and 3 days. This is normal placenta at 16 weeks and 3 days. Primary, secondary, and tertiary stem villus vessels can be clearly identified using SMI. Using SMI, primary, secondary, and tertiary stem villus vessels and whole spiral artery jet flow can be clearly depicted after around 20 weeks of gestation. This is 3D SMI of the normal placenta at 26 weeks and 5 days of gestation. As you can see, primary and secondary and tertiary stem villus vessels are clearly recognized, and several whole spiral artery jet flows are more clearly identified using 3D SMI. In the normal placenta at 30 weeks of gestation, SMI clearly depicts intraplacental blood vessels and spiral artery jet flow as shown in this slide. This slide shows the comparison of placenta blood flow between conventional color Doppler and SMI in the same case with the previous slide. As you can see, SMI clearly shows intraplacental blood flow compared with conventional color Doppler. This is 3D SMI of normal placenta at 30 weeks of gestation. This slide shows a normal placenta at 34 weeks and 3 days. This is the comparison of placenta blood flow between conventional color Doppler and color-coded SMI. The right side is the color-coded SMI. Color-coded SMI shows detailed intraplacental blood flow compared with conventional color Doppler. Here you can see, this is SMI image of the placenta using an 18 megahertz probe at 34 weeks and 5 days. Detailed placental vasculature can be clearly identified. This is 3D SMI image of the same case with the previous slide using an 18 megahertz probe. Spatial relationships of intraplacental vasculature can be clearly noted. As you can see in this slide, in normal pregnancies, placental blood flow is significantly reduced during uterine contraction in both spontaneous and induced labors. This slide shows the comparison of percent change of placental blood flow during uterine contraction in different specimens in normal pregnancies. The reduction of placental blood flow during uterine contraction in induced labor is evident than that in spontaneous labor in all specimens. In conclusion of the second topic, the spatial relationships among the umbilical cord vessels, chorionic surface vessels, stem villus vessels, spiral arteries, and decidual vessels could be clearly identified using SMI. Uterine contraction in both spontaneous and induced labors causes a significant reduction in placental perfusion. Reduced placental blood flow in induced uterine contraction has a tendency to be marked compared with that in spontaneous uterine contraction. Okay, the third topic is placenta vasculature in FGL pregnancies. This is thick placenta with FGL at 90 weeks of gestation. Placental thickness is 69.3 meters. As you can see, no blood flow in the placenta using conventional color Doppler. SMI clearly demonstrates very sparse villus trees in the placenta, and each stem villus vessel has become very straight. Only primary and secondary stem villus vessels can be identified. This is 3D SMI in the same case. Very sparse villus trees in the placenta are evident. This slide presents macroscopic findings of the placenta after delivery. The placental weight is only 350 grams. The diagnosis is partial circumferent placenta. This slide shows an extremely thickened heterogeneous placenta, namely jelly-like placenta, with a severe FGL at 31 weeks and 4 days of gestation. You can see the very heterogeneous internal textures of the placenta using high-resolution ultrasound. SMI depicts long primary stem villus vessels and reduced intermediate stem villus vessels, whereas conventional color Doppler shows almost no blood flow in the placenta. 3D SMI clearly demonstrate very sparse stem villus vessels in the placenta, and each stem villus vessel becomes straight. Especially primary stem villus vessels are thick and long. On the same day, CTG monitoring showed decreased variability and prolonged deceleration, and emergency cesarean section was performed, resulting in a single female newborn weighing 832 grams. The placental weight was 250 grams. This is third case of the thick placenta, okay, at 33 weeks and 2 days. SMI demonstrate long, straight primary stem villus vessels in the placenta. 2 days later, spontaneous preterm labor started, resulting in a single female newborn weighing 1,487 grams. So the thick placenta with FGR are very sparse villus trees in the placenta. This is the most important findings. This is another result of placenta vascular sonobiopsy between normal and growth-restricted pregnancies. Placenta vascularity and blood flow are significantly decreased in FGR pregnancies, in particular after 32 weeks of gestation. In conclusion of the third topic, the unique SMI characteristics of a thick placenta with FGR are sparse villus trees, and each stem villus vessel became straight. Placenta perfusion or blood flow is reduced in FGR compared to normal pregnancy, especially after 32 weeks of gestation. Okay, the last topic is the use of an 18 megahertz probe and placenta ACCRETA. In this topic, the aim to use an 18 megahertz probe is to diagnose abnormally adherent or invasive placenta in the retained placenta after vaginal delivery. This is normal placenta at 16 weeks and 6 days of gestation. High-resolution ultrasound and SMI with an 18 megahertz probe clearly show this is the placenta baseline with decidual vessels between the placenta and myometrium. The uterine wall is thick. Arcuate arteries in the uterine wall are also noted. This is the arcuate artery. This is the myometrium is thick and the same thickness. This is normal placenta at 27 weeks and 1 day of gestation. This is the myometrium, and the placenta baseline is clearly identified. In this patient, the abdominal fat is a little bit thick, but still we can identify the myometrium. Okay. SMI clearly showed the placenta baseline with or without decidual vessels between the placenta and myometrium. Okay. This is normal placenta at 34 weeks and 5 days of gestation. Okay, this is the placental baseline. It's very clearly identified using 18 megahertz probe. We can easily identify the placental baseline beneath the decidual vessels. And the myometrium thickness is almost the same. This is color-coded SMI. Also clearly shows the placental baseline here beneath the decidual vessels. This is monochrome SMI of the normal placenta at 34 weeks and 5 days. monochrome SMI more clearly shows low velocity blood flow in both placenta and myometrium compared with the color-coded SMI. In the first case of placenta ACCRETA, this is a 37-year-old Japanese woman who was referred to a university hospital because of retained placenta and excessive postpartum bleeding after delivery. Conventional 2D sonography and SMI show no clear signs of abnormally adherent or invasive placenta, as shown in this slide. This part is a little bit suspicious, but still unclear. Okay. This is a high-resolution ultrasound SMI images. Using 18 MHz probe, clearly depict irregular minimal invasion of the retained placenta into the anterior myometrium, and a thin uterine wall is noted. SMI reveals disruption of decidual vessels at this pathologic lesion, and abnormal lacunar flow is also noted. In this case, ultrasound-guided removal under general anesthesia was performed, and removal of the placenta was successful. However, there is a very tight attachment between the placenta and the uterine wall. And histopathological diagnosis of the removed placenta was placenta ACCRETA, namely the belly attached directly to the myometrial tissue without intermediate decidua. In the second case of placenta INCRETA or PERCRETA, a 40-year-old Japanese woman spontaneously aborted in our university hospital at 18 weeks and 6 days of gestation. She had undergone enucleation of uterine adenomyosis at another hospital 20 months previously. Okay. After she delivered, the placenta remained in situ. This is conventional color-coded SMI in this case. As you can see, abundant blood flow is evident in this case. Okay, this is conventional monochrome SMI in this case. Okay, tremendous blood flow is very clearly identified even if using conventional ultrasound and high conventional SMI. Okay, high-resolution ultrasound with an 80 MHz probe clearly demonstrate the loss of myometrium anterior to fundal lesions. SMI depicts abnormally tortuous, abundant blood flow invading until the uterine serosa. Okay, this part is there. Loss of myometrium is also noted. Invading abnormal blood flow here to the myometrial serosa is also identified using 18 MHz probe. As you can see in this slide, snowstorm-like blood flow pattern is also identified. In this case, there was no excessive vaginal bleeding. The placenta was left in situ, and the patient was discharged without any adverse events because the patient desired for another baby and refused hysterectomy. The patient is now scheduled for monthly scans until the placenta has been completely reabsorbed. This is the third case, a little bit different case. This case is a pregnancy after previous uterine fundal incision of placenta previa with ACCRETA at 30 weeks of gestation. We cannot clearly identify an uterine wall with conventional 2D. However, as you know, we can clearly identify very thin, uterine wall using high-resolution ultrasound and SMI with an 80 MHz probe. In this case, placental baseline here is clearly noted, which is different from placenta ACCRETA. Moreover, no abnormal blood flow cannot be recognized in this case. Okay, this is normal placenta at 30 weeks of gestation. In normal pregnancy, uterine wall is thick, and its thickness is the same between fundal and anterior regions. Here is the fundal to anterior, the same thickness. Okay, this is macroscopic findings of the uterus in this case during operation. Membranous uterine here, wall at the fundal region is evident in this case. So there are still limitations to use an 80 MHz probe. So the most important thing is the penetration. The penetration of an 80 MHz probe is so shallow, maybe within 2 or 3 centimeters. Thus, this abdominal probe can be used only for anterior implanted placenta. Moreover, this probe may not be used in the obese women. Okay. In conclusion of the fourth topic, high-resolution ultrasound and SMI with the use of an 80 MHz linear probe may become a novel diagnostic tool for detection of abnormally adherent or invasive placenta. This slide shows the final conclusion of my talk. SMI provides a more comprehensive, detailed view of the intraplacental vasculature in a normal placenta and a thick placenta with FGR. SMI might also facilitate the discrimination from a normal placenta and other placental abnormalities, such as abnormally adherent or invasive placenta. Okay, thank you so much for your kind attention.